Today we're going to do a cervical injection on this lady, this young lady, who's got tooth pain. Would you tell me a little bit about your tooth pain?
My tooth pain is excruciating. I was eating an apple last night and it broke, and I feel nauseous. I have a headache. My eyes hurt. Every part of my head, from my shoulders to the top of my head, hurts right now. My ear, everything. So.
Okay, on a scale of 10, how bad is the pain?
About getting closer to a 10. It's a 9.5 right now.
Okay, let's go ahead and take a look at your tooth. I'm going to come in close. So it's the canine that fractured off?
Mm-hmm.
Okay. Do you have any allergies to any medications?
I'm very allergic to penicillin.
Okay.
1,100 miles.
Okay, so this is the equipment we need for the cervical injections. I have a 3cc syringe, 18 gauge needle. I have the bupivacaine, 0.5% without epinephrine. And I'm going to draw up about 3 cc's, a little bit extra to fill the second needle. And then I also have the Panies, the vapor coolant that actually is useful for pain control as you do the cervical injections. And 25 gauge needle, 1.5 inches. So you're putting in some Cavit right now, packing that tooth. Okay. All right, so we're going to do the cervical injection, and the first thing we're going to do here is we're going to go ahead and clean off the skin.
Okay.
Our patient has had some ibuprofen, about 800 milligrams. So yeah, tell us a little bit about where your pain is at.
It's in my eye socket. It's just in my ear is sore. My jaw, the left side of my jaw, the pain is just excruciating.
Okay. All right, now, so I'm going to need your head straight up and down. We don't want your head bent down.
Okay, it's still bent down, so just.
Okay, that's good, exactly where you're at right now.
Okay.
Then I'm going to use this vapor coolant, and I'm going to spray here until I get a little frosty, and that causes some discomfort here.
Yep, it does.
Okay, and
bit.
and then I'm going to go ahead and put in the bupivacaine, inject the bupivacaine. So I do a little distracting pressure with my finger there,
Yeah.
and so we're going to go all the way in, in that, and I'm going to aspirate back, and then we're going to just inject slowly. And meanwhile, my left hand is doing some distracting pressure.
You're doing a good job. You're a very good distractor.
Good.
You are, because usually I'd be screaming.
I will put that in my resume.
Okay, and I'll sign it for you.
All right. Okay, so that was 1.5 ml. 1.5 ml in that area. All right.
You did that? I didn't feel it.
Very good.
Yeah.
All right. So now we're going to go ahead and do the second side. Many times people have a little bit more discomfort with the second.
That hurts worse.
It actually might do that because.
But if it makes it not feel the shot, I don't care.
Yes. Distracting pressure. Parallel to the floor. Parallel to the floor. I'm going to about C6, or C7, and I'm aspirating back. And again, with the second shot, where you've already used the needle once, people have a little bit more discomfort, and I detect those sounds are discomfort sounds.
Yeah. I'm done. Are you done?
Just injecting slowly.
Okay.
So I'm parallel to the floor. You don't want to, if you point down towards the dome of the lung, the chance of getting a pneumothorax.
Okay.
All right, and then come back out.
Oh.
All right, and that's the procedure. Then go ahead and sometimes I'll massage in the bupivacaine, and after that we'll put in a Band-Aid. So you had a little more discomfort with that.
Yeah, second side I didn't feel the first side at all.
Okay.
Not whatsoever.
And sometimes,
not even a poke.
And you did tell me that your muscles are real tight.
This side is really.
And so.
This is not.
And so when you go into the muscle with the needle,
yeah,
people definitely will get more pain in the process.
In the tight one, huh?
In the tight muscles. So that's what we did.
Can you feel the difference in the tightness in this one?
It's subtle, but yes, I think I can.
Like right there. Oh.
Okay. So that's the technique. We will put Band-Aids on there. So the cervical injection works fairly fast. On headache pain, I've seen it within 5 minutes, give complete pain relief. Many times with oral facial pain, it may take 15, 20 minutes. And in your case, you have both a headache and face pain and tooth pain. And so we'll be back in about 15, 20 minutes.
Okay.
And we'll basically see how you're doing.
Okay, thank you.
All right?
Okay.
All right. All right, so how long has it been since the injection?
A few minutes, a couple
Like-
minutes.
It's under 5 minutes?
Yeah, I feel much better now.
Okay, so what
I feel tingly. My face feels tingly. I just feel a little sore. My
Okay.
ears a little achy, but other than that, the pain is gone.
so on a scale of 10, how bad's the pain?
It's not pain.
Okay, so you have some sort of
discomfort.
some sort of a discomfort. So your
Just my ear.
your tooth pain is gone.
Gone.
The pain that was being referred to your ear is gone.
Gone.
Your headache's gone.
My headache's gone. It was more in my eyes. It was more of an eye socket type headache, and just up the side of my face.
Right.
It's gone.
Okay.
It's gone.
What
Now
about
I
the
just want
nausea?
to-
You had some nausea.
I'm not nauseous at all.
This benefit will potentially last for forever, or you may start to have some pain come back.
Okay.
But we're sending you home with some limited number of pain medications. Nothing
Okay.
with codeine in it, since you're
Okay.
sensitive to codeine.
Okay.
But I want you to take like Motrin in addition, anti-inflammatory medicines,
Okay.
and when the pain gets real bad, then you can take some of the Percocet.
Okay.
All right?
All right.
If it comes back, it may never come back.
Well, whoever's watching this, if this doctor or any other doctor ever asks you, do it. Just do it.
Okay.
The shots, the first one, if your muscle's not sore and 10-step, you don't feel a thing. The second one, if you have tension, it's worth the pain. It's only a little tiny bit of pain for a minute and it's over. It's well worth the procedure.